Thank you for coming to watch Dr. Smith's video today. We encourage you to hit the subscribe button and the alert button. That way you can get notifications when he uploads a new video. Thank you for coming today.
So we hope you take the time to hear and think about, and if you have a book, read in the book about the concept and the topics that we talk about. They have a lasting effect. The intent is not necessarily to treat pain, but to make permanent, long-term correction with your whole family and your friends.
Thank you. Make sure you subscribe and hit the alert button. Have a good day.
Have a good day. So, why do we have a lesson on arthritis? My main interest is to help you understand the kind of big picture about arthritis, and the focus is on prevention. You have a younger family, you have friends, and they don't know the big picture about arthritis. They've been misguided a lot by the medical profession, because the medical profession has given the overall impression that if you have arthritis, you have it the rest of your life, period. They tell you there's nothing we can do for arthritis other than treat symptomatically. That is true. That's what they do. They treat symptomatically once they give you a diagnosis. I've told you before many times, and I learned it from the textbooks first, then I've learned it from practical application in my own life and in the life of hundreds of patients. This principle: there is a continual turnover of all connective tissue. All connective tissue is regenerated and made anew. Where do the cells come from? Stem cells. Stem cells are made in your bones by the millions every day. Stem cells become whatever they needed to become, and they become specialized. They can become a red blood cell, they can become a white blood cell, which then further specializes into the things I've told you about before when we talk about the lymphatic system. The neutrophils are the big ones, highest in number. When you look at your blood test and the white blood WBC, it'll have neutrophils. It'll have a big number. It will have the range, low range, high range. You should be somewhere in between, which lets you know by divine design there are always neutrophils floating around in the blood and in the lymphatic system, and further in the joints. We're going to talk about that today. And they're looking for trouble. They're there all the time. Then you have lymphocytes. Remember the acronym? Never let monkeys eat bananas. The first three, neutrophils, lymphocytes, monocytes, are always present. If they need further help fighting something, the monocytes put on their armor like a policeman would put on riot gear and become macrophages, and they go around fixing things up, helping the body fix things up. So, what does that have to do with arthritis? Arthritis literally means, arth means joint. Itis means infection or inflammation of a joint. I'll separate the two for you. Anytime you have injury in any tissue, one of the first stages toward recovery is inflammation. You get cut, you get a bruise, you pull a tooth, any kind of damage in the body, you get inflammation. The neutrophils show up to clean up the area. The lymphocytes clean up more, different type of cleaner, and on. The specialized cells. New stem cells come in and fix up the wounded tissue. That's inflammation. It's usually painful. It's usually could be red, could be swollen, could be hot, could be stiff. Those are the three primary symptoms or signs of inflammation. If the tissue that's damaged gets contaminated with pathogen, a pathogen is a virus, a fungus, a yeast, a bacteria, some kind of a live organism that gets in the tissue that's damaged, that then becomes infection. When you get infection, it's a whole different ballgame. So you kind of think of it like a spectrum. You have an injury, you have a bit of inflammation. If it fixes it, fine, that's all good. If it doesn't fix it and lingers on, or you have a new injury to the same tissue, and that's very common. It's common with what we're talking about today, because arthritis is caused mostly by repetitive micro-trauma. So it creates a damage. Do you want notes? You okay? It creates a damage to the joint tissue. If you re-injure an injury, then your recovery time takes longer and the quality of recovery is less good because you've re-injured an injury. And if you do it again and again, you can develop a chronic, low-level inflammation. If it's on a joint, then you technically have what's called osteoarthritis. Osteo means bone. The bone joint inflammation.
You said if recovery takes longer and you can develop chronic.
Chronic means it's chronic versus acute. Acute is you get
Right, but you said you had a word chronic.
degenerative.
Degenerative, okay.
If joints become injured and deformed, then they wear out sooner, just like your car tire on your car. You get a chuck hole in like your alignment off, it's going to wear out quicker. If you hit a curb and damage the tire and it shakes, it's going to wear out sooner. Joints are the same way. So we call the number one cause of arthritis is repetitive microtrauma, which creates faulty biomechanics. Anytime you have faulty biomechanics in any joint, you have compromised additional faulty biomechanics, at least in the two joints, distal or proximal. That means if I have an elbow injury, I also have malfunction in my wrist and my shoulder, guaranteed.
So I have a sister-in-law who's had severe both types of arthritis for years and years. And how can you get your whole body injured repetitively to cause that?
That's a good question. most people have whole body arthritic problems, have faulty biomechanics due to forward list, head forward posture, which then causes faulty biomechanics in the foot. When the foot is compromised, well, they have faulty biomechanics in the foot, in the ankle, in the knee, in the hip, the pelvis tips. You have faulty biomechanics all the way up the spine to clear up to the base of the head. When the head has faulty biomechanics on the spine, you have cranial faulty biomechanics. So you have a whole ball of wax. That can come from a stub toe, which causes you to walk with faulty mechanics for a long time. If you hit it again, or if you're chemically deficient to acid, and the toe doesn't heal because of chemistry, that makes everything worse. That's a very good question. Now, the other trigger for arthritis is not micro, meaning small, not small repetitive motions, but single macro. When I think of macro trauma to any part of the body, I think of a Mack truck. Yeah, bang. That could be caused by a baby falling out of crib, crashing on a bike, tripping on a step, landing on a shoulder. Any kind of car collision causes macro trauma always somewhere. We talked about that in that auto class, and how even a small parking lot injury creates changes in the biomechanics. When it changes in the biomechanics, then you have the stage set for degeneration. Now, that's kind of an overview of arthritis. How do you fix it? You recreate the best you can within tissue tolerance, motion, balance, and alignment. I talked to you about MBA before. To always think about having MBA, motion, balance, and alignment. If you have a weakness in any of those three, then you have compromised biomechanics and the joints deteriorate sooner. Now, the bad news is worse than that. If you have faulty biomechanics in the spine, of the head, you then also have additional neurological malfunction. And you can have a 5, 10, 15, 20, 25% nerve malfunction with no symptoms. In other words, you can have a problem and not know that it's there. That's very common, especially with micro trauma, because it comes on gradually. What are the first signs? The first signs are tiredness, weight gain, stiffness, to start a few. Micro trauma, you can have a micro trauma and then have compensating changes due to the weakness of the tissue in other areas. Like I said, if you stub a toe, it might take you months to get a problem with your knee or your foot. A simple thing I do, and you can do too, is to have someone take a picture of you walking from the back and the front, like have you walk down the hall and come back. I learned a whole lot about your biomechanics, top to bottom. When you stand face on, how you hold your shoulders, your head, where your weight is on your feet, all demonstrate faulty biomechanics. It's very easy once you know what normal is to spot abnormal. And the way to spot abnormal is to look at other people walk, like how other people stand. For example, I've told you when you go shopping to hold your shopping cart like this, not like this. If you hold your shopping cart like this, you will get closer, you will stand up straighter, you will move your shoulders back, you'll move better. And if you do that for a while, you'll notice the other shoppers
Leaning on the
leaning
hands.
on that.
I do that sometimes.
I had a fellow come last week. I asked him, what is your major complaint? A big tough guy. He said, my thumb. I smiled and thought, oh really, your thumb, huh? I said, what happened to your thumb? He said, I don't know. It just started hurting. Okay, so in my mind, I know that thumbs just don't start hurting that for no reason. So I like what I call upstream. To me, upstream is the wrist. And it had pain in the wrist. I went further upstream. He had more pain in the elbow. I went further upstream. He had a lot of pain in the shoulder. I went further upstream. So I'm falling back up. Oh, his neck. Yeah. So with that kind of problem, I knew he would have problems in his mid and low back. And even in his leg was excruciating because he had done something he hadn't been used to. I said, so, okay, what have you been doing? Nothing really different. Well, come on, you've done something. Well, he had been riding on a tractor. You know how you ride on tractors and you look back and you look back, and so it was torqued. His whole body was torqued and it's bouncing. Bouncing makes everything worse. So how did that affect his thumb? The answer, faulty biomechanics in the core created faulty biomechanics in the shoulder, the elbow, the wrist, the thumb. So the fix was not in the thumb. The fix was in the whole spinal column to recreate better motion, balance, and alignment. So lots of times with symptoms, you have to go upstream with the body top to bottom. Now, the other topic, we're going to come back to arthritis in a minute, but the other topic today was the concept of bone on bone. Now, bone on bone, it sounds, that has a nice ring. Bone on bone is a marketing phrase. It is used commonly with orthopedic type doctors to motivate joint replacement. And it works good because that sounds bad, bone on bone. Now, the truth is, I'll go back upstream. When the baby is born, an infant, the bones are very small. The baby has 270 bones. As they grow, they become taller and taller. The long part of the bone, the arm or the leg, the long part, and the end part of the bone is called the diaphysis and the epiphysis. Not that that makes a difference, but the end and the long part grow together. When you finally get grown up, you now have 206 bones. So you went from 270 down to 206, and now you have lots of bones.
Did you say 270?
270, and an infant, down to 206. give or take 1 or 2. Sometimes people have an extra one in the foot or the hand somewhere. We have all joints. They have about 300 joints in the body. You're going to be tested on this, so remember that now. 300 joints. Most of them are bone on bone. The big joints, like the knee and the shoulder, the elbow, the ankle, have a pad between the bones because they get a lot of heavy wear and tear, and God, by divine design, gave us some extra support. In the shoulder, you have bursa. You've heard of bursitis and bursa tear, and you've heard of rotary cuff syndrome or rotator cuff or some fancy name to label the shoulder pain so they can do a diagnosis and get paid or do surgery, whatever they want to do, or an injection. But most joints, most of the 300, it's bone on bone. Almost, not totally. What's in the joint is called synovial fluid. I want you to think, when you think of the word synovial, that's S-Y-N-O-V-I-L-I-A-L, synovial fluid. It has a texture much like egg white. It's a slight light yellow color. It's very smooth and it's very thin. So all of the joints have a thin amount of lubrication. So think back a few weeks ago where we talked about the circulatory system, we talked about blood, we talked a little bit about plasma, and then we talked about the lymphatic system. You have 5 quarts of blood, you have more lymph fluid in the body than blood. You know that, right? The lymph fluid is everywhere. The lymph fluid seeps into the joints. As it seeps into the joints, there are specialized cells who tweak them just a little tiny bit, give them a little different chemical composition, and that now it's called synovial fluid. It came from lymph, which came from plasma, which came from blood. So going around the body, the plasma seeps out down at the capillary level and becomes lymphatic fluid. Then it seeps into the joints. It becomes what?
Synovial.
Synovial fluid to lubricate. So that's bone on bone. Now the big joints, again, like the shoulder, the knee, the ankle, the elbow, have more need for more lubrication and more protection. So they have a capsule, a joint capsule. And within the capsule, you have an abundant amount of this synovial fluid. You have a lot of it. And just like the lymph fluid, just like the all blood cells, they're continually being replaced by new fluid. Even the structures in the head that interlock with each other, aligned with synovial fluid to help them move. When you breathe, the head gets bigger and moves, and it's just stuck. Sometimes you get jammed, and you have inflammation. And you can have arthritis develop in the strictures of the cranium. That reduces normal biomechanics, so faulty biomechanics again. Does that make sense? Any questions? Now, if you have a foot problem with faulty biomechanics, would you expect that you may develop arthritis in the foot? Yes. If you have faulty biomechanics in the upper spine and you have head forward posture, we do expect to have arthritis in the neck or in the upper back. Yes. What if you have chronic head forward posture and your shoulders are rounded forward like a monkey, so your knuckles show when you walk instead of your thumbs? You have faulty biomechanics here. Would you expect to have arthritic hands? Yes. So what if we just treat the hand? That happens all the time.
Yeah.
Every day, people go to the doctor with arthritic hands. Do they get a correction? No. If the doctor says, we can't do anything about arthritis in your hands other than treat your symptoms, is that a true statement? Yes, it is. Who can fix that? The doctor within. Okay? The doctor within. By divine design, all tissues turning over.
But if you have a subluxation that's not corrected, then that impingement will stay there and still affect your shoulder, elbow, wrist, and hand until that's maybe corrected, so that then your body can heal.
That's exactly right. What do you do at home on a routine basis to correct spinal column pelvic
Sacral slide.
subluxations? You do sacral slide. Feet up, feet out, feet in, both ways. And you then do the occipital release to change the balance mechanism and the motion in the head to allow your body to move back into better alignment. Now, it's common, not normal, common, to have people have knee replacements, shoulder replacements. We live in Idaho Falls. We have an abundant, we have an excess amount of what?
Orthopedics.
Orthopedic surgeon.
And they're all busy because they market joint replacement, bone on bone. There are too many attorneys too. But the sales pitch works. And the doctors are honest when they say, there's nothing I can do because you can't fix arthritis with a pain pill, with a pill. It has to be, it's a faulty biomechanical issue. And that can only be, it can't even be corrected by chiropractors. And they claim, we can fix those things. You can't, because they don't stay. When you pop them in, they come back out because of posture. Posture is the key. Neutral posture with proper motion, balance, and alignment. Now let's go back to arthritis.
Okay, so where do supplements come in to help, heal this?
Remember I said to you, sometimes the synovial fluid is too acid due to too much sugar, not enough water, excess protein, incomplete or improper digestion and assimilation. How do you know if that's a factor? Simple. You can test your urine pH to see what your body's throwing out. If your body's always throwing out acid, then you know you need a diet change. You need some kind of nutritional support to help make better stem cells and to help make better synovial fluid.
Bring it back in balance.
Bring it back into balance. So, micro trauma, fluid imbalance, macro trauma, long term, the joint is in trouble, the patient's immune system is down, and now we change from osteoarthritis, we advance into rheumatoid arthritis. Rheumatoid arthritis is when not inflammation is present, but also infection. Now you have an aggressive breakdown of not only the bone part, but the joint part. Rheumatoid arthritis is extremely serious. It's always chronic. It's always long standing, and there's no recovery according to the medical profession. They treat symptoms. That's what they do with a lot of different drugs, all of which have significant major side effects. You don't really trade one problem for another. You add a new problem or two or three if you take the medication for rheumatoid arthritis. So what's the cure for rheumatoid arthritis? The same basic concept of reestablish motion, balance, and alignment with proper nourishment to the whole body and time. Now, one of the key issues in what's called autoimmune disease, that's what rheumatoid arthritis is. It's a diagnosis, it's a named condition where the body is breaking down. The body has actually decided to destroy itself. So the infection tries to break the body down. And the drugs are designed to lower the strength of the immune system. It's a lose battle. The only people that win with rheumatoid arthritis are the doctors and the pharmaceutical companies that market the drugs, and maybe the surgeons if they replace the joints. But again, the solution is reestablish motion, balance, and alignment, and nurture the body, and make sure you get plenty of water, adequate sleep, adequate nutrition, with adequate balance. Does that make sense to you? Now, you know that the body replaces all tissue every 7 years. Thank you. The bad news, if you continue to have faulty biomechanics with repetitive microtrauma, the new tissue is also bad.
Say that one more time. Faulty biomechanics.
If you have faulty biomechanics chronically, like your body lifts forward and the foot goes down.
Right.
Or if you have an iPhone and you spend a lot of time on it, or a book, whatever. Head forward posture is a killer. Head forward posture causes not only arthritis, but also kills people with heart disease. It has a major effect on the circulatory system.
So when you read, like when I read the scriptures, I should have them up here. I use my iPhone. I mean, I have the scripture book, the Book of Mormon. Do I need it up like this?
Are you sitting or laying down?
Oh, I'm sitting.
Perfect question.
There's a pillow I have that's a triangle shape, but on the edges it is curled and it goes up and then it's curled this way. So you can use it, you can flip it around and it props up like an iPad or a book. And then when I'm sitting, I can put that on my lap and it's at an angle like this, so I'm looking ahead instead of looking down. And that has helped a lot.
Well, it's helped because it's reduced or stopped the negative effect is head forward posture. If you try to hold the book up here, then you go like this as you tire.
I try not to.
So
Give me a pillow. Where'd you get your pillow?
So when
I
you
got
have
it at
stuff like,
Barnes and Noble.
you can. There's a lot of things you can do. You can buy a small tripod that you can hook your cell phone on, and you can do all of it if you have your scripture on your cell phone or your iPad. You can put it right there. Back in the day before we had that, I recommended take a cushion off your sofa and put it on your lap, maybe two, and put a pillow on. You lay the book so you're right there. The normal distance is about 12 to 14 inches. You want your head level, so you don't want to have your head tipped. You want your head level.
So a pillow underneath my triangle would be
To raise it up.
beneficial. Yeah. Okay.
If you need to.
Perfect.
I read sometimes in bed with my phone. I take my big fat pillow and lay it on my chest, and so I lay my arms here. It's right there. I don't have to hold anything other than lay my hands on the pillow. Figure it out. You want to modify
I
your
tried it
posture.
this way about got a black eye.
well, even if you're sitting reading for 15 or 20 minutes, if you're doing all the other things he tells you to do, the sacral slide and the cranial, microcranial, what's it called? Motion, thank you. It corrects that, right? And anything you do this way, you want to reverse, right?
Counter stress.
So, yeah, you counter stress because you can't have perfect everything all the time.
Right.
So you just counter stress where you can.
Take your pillow.
And your body is so forgiving and so good that if you give it a little bit, it does a lot.
You can buy for just a few bucks. Thing that will hold your book. You know, I know we all read the scripture. Sitting at the kitchen table with one of those right in front of you is very convenient, and you know they're available at Staples and
I have a foldable wire thing that just,
does that.
yeah. So you were saying began a sentence, faulty biomechanics.
Chronically in the body.
Chronic faulty
of the body.
biomechanics affects the whole body. Whether the fault is in the head, the shoulders, the low back, the foot, it doesn't matter. If you got one, you got them all. And the longer you have them, the more wear and tear you have, and the shorter your life. At class yesterday, I had somebody said that their mother could not use her hands to open bottles or do anything because the arthritis was so bad in the hands. Because where the shoulders were.
Mm-hmm.
It's all connected. So even in an old person, I'll tell you another story. I had an old man. He came into the clinic one time, and he was hunched over. We had a counter, so the girl sat behind the counter, and he couldn't get up high enough to look over the counter because his head's down here, and his daughter was with him, and I checked him over and said, you know, he's too far gone for me to really make a difference. I can guide you, but you're going to have to do the therapy. So I recommended they get a rocking chair, put him in the rocking chair, put a collar on his neck to hold up his head, and tip him back so the head was back behind center, and have a grandkid or somebody rock the chair. I mean, he was pretty bad off. And I said, have him do that for 2 or 3 weeks and come back. When he came back, he came in all smiling. Walked up to the counter, he could see over it. I only saw him a couple of times, but they, that little change in his posture made a huge difference. And it will for anybody. Again, the principle is the same. So the true healer is the doctor within, a God-given design. And again, by divine design, God has made the knees different, the shoulder, even the heel. The heel can develop pads. It's called bursa. It's an extra pad. When you get osteoarthritis, you have that faulty biomechanics, so the joints are not sliding and gliding like they should. They're closer on one side. The bones will harden. When the bones harden on both sides, you have a bone spur. Now you go to the real doctor and he takes an X-ray. He'll say, you have arthritis. You're gonna have that your whole life. Well, we can do surgery. We can cut that stuff out. Well, here's the good news. If your body doesn't need that extra bone because you haven't recreated better alignment and better motion, guess what the body does with those minerals? What?
Dissolves it.
Yeah, it recycles them. It goes back into the system. I've had patients who've had car accidents, microtrauma, damage to the neck. The neck has developed spurs that put pressure on nerves going down the arms. They do the homework like I do, and within 1 year, we take a new X-ray of the neck and the spurs are gone. I mean, they're just gone. I had a patient named Esther. Esther had a lot of arm pain, headaches, neck pain, neck stiffness from a car accident. I took a picture. She had the degeneration and up here on the front, back here on the joint, on the fascial joints, a lot of arthritis. I said, you need to be faithful and do this self-care every day. You'll get better. About a year later, she had much better motion, less headaches, less pain in the hands. And I said to my staff, take a picture of Esther and put the X-rays up in my office. They took an X-ray of her neck, put the pictures up. I walked in and looked at the films and thought that those dirty dogs, they're trying to trick me. Those are not Esther's neck pictures. They were. The spurs were gone. I mean, they were gone. I said, that's proof. So you're proof that the spurs dissolve and the discs get thicker. They get more fluid back in them. So even the disc can improve. Okay, let's go to the test. Would one of you like to read for me? Okay.
Bone on bone may be partly true part of the time, but it is really a marketing jingle used to scare patients into joint replacement. True.
Yesterday in my class had a fellow who said, in my office where I work, I'm the only one without joint replacements. He works around other people, but I said, yeah. Okay.
To be classified as a successful surgery, it needs to last 5 years. If needed again in year 6 or after, even multiple times, each lasting 5 years, it's considered successful.
True.
Any joint that is out of alignment, not properly balanced, or not moving properly will degenerate faster. True.
So when I have patients who were in a car accident, and they had micro trauma, they had joint deterioration, we get them back pretty stable, but not completely stable. After about 3 years, 4 years, the insurance company says, we're done. We're not going to pay anymore. I'd have to write a letter to the insurance company and I would say, due to faulty alignment, aberrant, that means abnormal function. I anticipate this will deteriorate faster over time than if they would not have had the car accident. So when you settle with them, you need to pay for future care because of that reason right there.
Once a joint has been weakened chronically, arthritis can be expected and premature degenerative changes will occur.
True.
A joint that has pain, swelling, stiffness, or redness has degenerated and is probably arthritic.
True. Which comes first?
Inflammation, maybe pain. And then
Pain, swelling,
inflammation.
stiffness, or redness, all those.
You might get pain, you might get stiff. Okay.
So the swelling is the inflammatory response, and
Yes.
that happens right after the injury.
Soon after.
Yeah.
6. Once arthritis is present, it can never be reversed and or healed. False. Most joints have synovial fluid, a lubricating liquid, that aids in smooth, frictionless motion. True.
Where does it come from?
Blood,
In fact,
originally. But it's broken down to plasma too.
in fact,
Number 8, larger joints like the shoulders, elbows, hips, and knees have bursa, which is a fluid-filled sac that both lubricates and cushions.
True.
Number 9, a fatiguing immune system sets the stage for and then predisposes joints to weaken in function and then further degenerates into an arthritic state. True. Number 10, rheumatoid arthritis is an autoimmune disease where the immune system attacks the cells lining joints.
True. And it usually swells and it's very painful.
And it's usually has some type of infection to go along with
It
or
is.
something.
It's
That's the infection.
Infection.
So that's why you need an antibiotic.
That's why you don't need an antibiotic.
Well, one of the treatments with rheumatoid arthritis, it's giving them, what's the one that turns your teeth brown? Tetracycline? Give them tetracycline along with the other treatments that they have.
To slow the immune system down.
Yeah.
What the body really needs is exactly
The opposite. Okay. Methotrexate, diclofenac, naproxen, ibuprofen, and Relafin are the drugs of choice to cure rheumatoid arthritis. I don't know. Probably.
well,
At cure, you don't cure it.
The operative word is what? Cure.
Cure.
true. But
It's false.
None of those drugs. None
don't
of those drugs are designed to cure.
Right.
They're all designed to suppress the immune
They cover the
system
symptoms.
and reduce pain.
suppress immune system.
Okay.
And suppress pain.
Okay.
Number 12. Stem cell therapy is a new, commonly used treatment for arthritic joints. I would say yes.
True. Let me tell you about that. In my class yesterday, a person did the same thing I did. We got an ad in the mail on a free dinner at
Mm-hmm.
the restaurant to come listen to a talk about pain and pain relief. I went. He went too. I didn't know that, but we went at a different time. The whole class was taught by not a doctor, not even a therapist, but a salesman. And they talked about pain and how bad pain is for you, and on and on and on. And the whole meeting was about stem cell therapy. If you have arthritis in the shoulder, knee, or the elbow, those are the three big areas. We can send a nurse to your home and give you an injection of stem cells. And here's the deal. $5,000. Insurance won't pay for it. See, it's cash. We'll come to your home and see if you qualify. If you qualify, then we can send a nurse to your home to give you stem cell therapy directly into the joint to help the joint rebuild and repair the tissue. The whole talk was about stem cell and pain relief and marketing. If we come to your home to see if you qualify, the real question is, do you have $5,000?
Mm-hmm.
If you have 10,000 and you have, or 9,000, you have both shoulders, we can do both for 9. And if you want your knee done at the same time, she can do all 3, and we give you another discount. And most of the time, it will give you pain relief. That's what it's about.
Most of the time.
Most of the time. If 1 year later, you still have significant pain, which we determined was because you didn't get enough or whatever, we'll send her out and do it again. That was the whole pitch. And what do they do? They give stem cell therapy. Question: where do you get the stem cells? Well, we collect them from babies that are being born. We take the umbilical cords from babies and we help make stem cells. Can you get them other places? Well, yeah, sometimes they use aborted babies and they take the bones and grind them up and make. So some of them get their stem cells from either the umbilical cord or the whole aborted baby. So does the body make stem cells on its own? Answer:
Yes.
yes. Where?
In the bones.
Marrow, bone marrow,
When?
all the time.
All the
When
time?
needed.
How many? A few or a lot?
I would say
Millions.
sufficient that your body needs.
More than you can comprehend. The number of stem cells that are manufactured in the long bones on a daily basis in the multi-millions.
So you should be regenerating and getting well all the time.
Bingo.
What about the magnet stem?
The magnet stem is a nutritional product designed to help the bones be more healthy. Okay? And to make more and better stem cells. What if you have osteoporosis? Does that affect the quality and quantity of stem cell production?
Yeah.
Yes. Because the bone as an organ, the bone is an organ. Because of that, reduced quality of function makes less. So the repair is lowered. Now, I mentioned earlier that we all get new tissue every day. But here's the bad news. If we continue to do the same thing that wore the tissue down and made the tissue bad, and you make new cells in a bad environment, you get bad tissue.
That's your disease.
You only get better tissue if you change the degree of the recurring stress. And I use the words tissue tolerance. That's why it's very important for all of us, regardless of our age, to totally respect tissue tolerance. If you think you're close to the teetering line at your age, I say don't. If you question, don't.
What do you call it?
Teetering line.
Oh, teetering.
Yeah, you're just borderline. You're just
If
going to
you-
tip over and go downhill.
Like if your
Then
pain
don't
is
do
more
that.
than
Don't
5.
push yourself.
If you think you've reached the point of exceeding tissue tolerance, like when you hold your scriptures too long, and you exceed tissue tolerance, then you're going downhill.
So you should change position or modify what you're doing.
Bingo. Bingo.
Back to your dinner. So did anyone challenge them about the stem cells?
I was the one raising my hand asking the question, but he didn't know. I mean, he was not a doctor, he was not a nurse, he was not a technician, he was pure sales. He didn't have the answer. I knew the answer before I asked him the question. You know, it's like an attorney. I'm gonna ask you a question
You're setting me up.
that I already know the answer to.
Yes.
But, so he just danced around that. And the biggest thing was, we'll come to your home to see if you qualify. Now, the truth is some insurance companies do pay for stem cell therapy like I talked about. And that's done in the hospital. It's very rare. You have to
Leukemia?
big time doctors who do a lot of work with generate a lot of income. They get special care.
But is leukemia one of the, I want to say, isn't that one of the things they do stem cell replacement for?
Yes, but the people who give the talk would not recommend that in the hospital. Maybe on a trial basis. The marketing people were just, we'll do the joints. We'll do the non-life threatening. We're only about pain. We're not about fixing disease.
It's because when you inject stem cells into a joint, that's the only place they go.
That's it. They stay right there.
They don't move through the blood system or anything.
That's interesting because you take an aspirin, it goes throughout your whole body.
I was joking. I was joking. The body's going to take what you give it and do what it
And spread it around, right?
needs. You know?
Yeah.
And truthfully, if they're doing the shoulder, it's gonna, some of it's gonna get in the lymph system, and
Right.
get around, but that's the target. Okay, and are there any final questions or comments? So the good news is, arthritis is a condition that can be reversed, but only if the doctor within is alert, attentive, and on call. And you support the doctor within. You can always expect good results. Now, if you don't expect a doctor within to do the work that the doctor within has been designed to do, if you lack faith in the doctor, he won't go to work. I learned that from reading the good book. When Christ himself went into cities where they had no faith in him, he could not do miracles. And when the lady who just touched his robe was healed, he said, your faith has made you whole. I'm a huge believer in the power of faith. And in my book, I make this statement: the greater your belief in the true principle, the greater the power. And that's a true statement. I personally depend on miracles.
Well, we're looking forward to more miracles.
Yeah, we need a lot. We need more, and we've been told we'll have more,
Yes.
right?
Yes.
The greater your belief,
And something that's true, the greater its power.
the greater the power of the truth.
Of what you believe in. You could give a talk on that in Sacramento.
I'll try that.
Don't say that out loud, you'll have to do it. Okay, I'll do it. Yeah.
No, they don't want me to talk again.
By the way, I want you all to know, we're done. I want you all to know that